Hi, my name is Kalani. I'm a student physical therapist at Midwestern University, and today I'm going to be taking you through some thermal modalities. First, we have our patient here who is off of an acute injury. He rolled his ankle and he's got some swelling and inflammation down there. So we're going to apply an ice bag to his ankle. So to prepare, I've already pre-filled the bag with ice. You suck all the air out, all of it. Go all the way in. And you go about 1/4 of the way down. You twist, 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 and then you tie it. Just like this. And because we want to decrease the inflammation in my patient, we're also going to have him lay on his back. We're going to elevate and compress the ice to his lateral ankle. It's your right one, correct?
Left one.
Your left one? Okay. Sorry, I have a hard time with my rights and lefts.
Okay.
But before we get started, go ahead and take this foot down. You can set it up here for a minute. I'm going to just lift this so that it's a little bit more comfortable. How does that feel?
Feels great.
Okay, and it's above your heart. I'm just going to test your vascularity in your feet. I'm just going to press on your toenails. Is that okay?
Yeah.
Okay. Looks like you have good refill here. I'm just going to, do you have sensitivity to hot and cold at all?
Not any more than the average person.
Okay.
Very generalized average temperature.
So you're able to tell the difference?
Yes.
Okay. Okay, good. How about any past history of cancer?
I've got a grandma who has a tumor in her brain.
For you, I mean?
Oh, no.
Okay, okay. And I'm not seeing any wounds or anything, and your skin looks pretty intact. So I'm going to go ahead and apply this. All right. Right on this side. Is that okay?
Yep.
Okay.
Ah.
And now I'm going to use the compression part with this ACE wrap here. I'll lift. Get it nice and secure. Go ahead and lift for me. How's that?
It's real cold.
Okay. So, is it too cold?
A little bit.
Okay. So what will happen is your body heat will kind of warm it up and it'll start to regulate and melt. And you're only going to be here for about 10 to 15 minutes, 10 to 20 minutes. Is there anything that I can do to make you more comfortable?
You got any Sprite?
Unfortunately, no. Okay, so now my patient is experiencing some subacromial inflammation, and so we're going to try and calm it down with an ice massage. So what I've done is I filled this little Dixie cup 2/3 of the way with water, and then I froze it overnight, so now it's ice. Now I'm going to maybe break it and then peel it so the ice is exposed, and then I'm not making my fingers too cold. All right, so what this is we're gonna do this circular motion around this small area of inflammation for about 5 to 10 minutes, or whenever you feel numb. So you're gonna go through 4 stages. You're gonna feel cold first, then it might burn a little bit, then it's gonna feel a little bit achy, and then we get to the numbness stage. So when we get to numb, I just need you to tell me, just so I know when to stop. So usually it's around 5 to 10 minutes, but it's really just based on you.
Got it.
Does that sound okay?
Yeah.
Okay. First, I just want to screen, did you have any cancerous background? Have you ever had any sensitivity to hot and cold?
No cancer and only cold sensitivity in my teeth.
Okay, okay, sweet. So if I touched you here or here, you could feel that my fingers are a little bit cold.
Yeah.
Versus if I touched you with my arm, it's warmer.
Mm-hmm.
Okay, okay, good. All right, so I'm just gonna go ahead and get going. Let me know when you go through each stage, okay?
Okay.
All right, so it's just right here, and it's good that we keep moving constantly. Otherwise, Otherwise, it might get a little bit burny real too fast.
Yeah.
Make sense?
Sorry, it's melting so quick. My wife says I run hot.
Okay, now we're back after the treatment. I'm just checking the skin, making sure everything looks okay. It's a little bit red, but that's just because we put a lot of thermal dynamics on it. So yeah. Anything else that you can think of that you have any questions about?
Not really. Feels pretty good.
Good. Okay, so now my patient is experiencing some low back pain, and so we're gonna do a moist heat pack to help with that. So normally a moist heat pack would come out of a hydrocollator, but right now I only have a moist heat pack that is coming out of my microwave. So let me go grab that. So this is the size of the heat pack, and it's filled with corn, so it holds in moisture instead of rice. And now I'm gonna do the 6 layering for it. So we got 2 with a towel. I'm just gonna, before we start, I wanna make sure that the patient doesn't have any skin lesions. Looks okay. How's your temperature down there? Can you differentiate between hot and cold?
Yes, I can.
Okay. Alright, I'll just leave your shirt down. And I'm also going to put these under your shins so that it will be a little bit more comfortable. How's that?
Perfect.
Okay. Alright, so we got our first layer. I'll put it just on him. So this is 1, 2, 3, 4 layers right here. And then we have 5 and 6. Perfect. Now typically we would leave this on for 10 to 20 minutes. And since my patient was having like some muscle cramping and spasming with his low back pain, this is the modality I chose. Just because it will help with treatment later as we're improving blood flow to the area, heating up the tissue, so it's ready to work. Okay, and now I'm taking all the layers off. And we're just gonna do a quick skin check to make sure everything looks okay. No heat rash, no lesions, no wounds prior, so no infection at all. So my patient is looking good. How do you feel?
Like a new man.
Nice.